This video is an introduction to Chapter 6, Anatomy and Physiology. We'll focus on the anatomical terms for body direction, movement, and position. We'll also introduce the rest of Chapter 6. Principally, in Chapter 6, we'll understand the 11 body systems that work together to maintain what we call homeostasis, that steady state that our body should exist in. So we'll look at the respiratory system and cardiovascular system working together to circulate nutrients and oxygen. We'll look at the muscular system and skeletal system working together to control movement. We'll consider the nervous system, and we'll look at the digestive system, the reproductive systems, the lymphatic system, and all of the others, 11 body systems. To properly assess and manage a patient, your knowledge of anatomy, the structure of the human body, and physiology, its proper function, will be important. Injury or illness to one system can cause problems with other systems. That's why your understanding will help you properly recognize and treat injuries and illnesses. Finally, mastery of anatomic terms will allow you to correctly communicate both in written reports and as a handoff to EMS providers. When we begin with anatomy and physiology, we can understand the difference between those two terms. Human anatomy is the structure of the body, simply the what, and that could be at the large scale, the macro scale, the gross anatomy, or it could be on the fine scale, the microscopic anatomy. Physiology is the how, the mechanical or biochemical functions of the human systems. Now, structurally, from the very small, we have cells that are the basic units of all living things, and cells can aggregate into tissues when we have similar types of cells working together for a specific body function. Those tissues aggregate into organs, and organs will aggregate together to one of our 11 body systems. Anatomical terms begin with straightforward terms for body planes and directions. We can think of the body as being divided or split along 3 axes. If I was to slice the body right down the middle, through the ears and the shoulders and the hips and down through both knees, the front of the body we say is anterior and the back is posterior. If I was to slice the body into a top and a bottom through the hips, we would say superior, closer to the head, and inferior toward the feet. Finally, right down the midline, we can describe things as being close to the midline, medial, or lateral, being farther away. Additionally, we can use some terms to help further distinguish where perhaps an injury has occurred. For example, if we just looked at the upper arm, we can see proximal perhaps would be closer to the elbow, distal would be closer to the wrist. Superficial might be something that is near the surface of the body, say an abrasion or a simple burn. Deep would be away from the surface, maybe a penetrating laceration or a 3rd-degree burn. We can also use the terms internal and external. Now we can, in addition to just describing anatomical positions, we can describe movement. A familiar one, if you've ever lifted weights, is flexion and extension. A bending movement is flexion, such as we see here, flexing the biceps. Extension is the straightening movement, and we would use a muscle in opposition, the triceps, to help extend. If we add the prefix hyper, we're talking about movement beyond normal, so you can hyperextend your knee. Finally, we can talk about abduction, the same root term as kidnapping, taking away. If I move my upper arm away from the body, it's abduction, and if I bring it closer, it is adduction. We close out our anatomical terms by just talking about body positions. The normal anatomic position is standing with arms at the sides and palms facing forward. Similar to the normal anatomic position is on the ground, and in this case, we would say the patient is supine. If they're rolled over, then we say they are prone. Finally, if we find a patient on their side, we can describe which side, right or left. Lateral means side, and recumbent, lying down. Think of a recumbent bicycle. In the clinic, we oftentimes will place a patient into what we call the semi-Fowler position. This is just a comfortable position that lets us communicate with the patient. This would be for a patient who is alert and perhaps does not have severe injury or illness. For patients with breathing difficulty, we may sit them up higher. This is the high Fowler position. The upper body is raised, Fowler position, but not semi, completely to the high Fowler position. In summary, the anatomic terminology will let you communicate both in the written form and with EMS providers. We have a nice summary with the graphic here. Remember, towards the middle is medial and away is lateral. Top superior, bottom inferior. Front anterior, back posterior. Practice these terms and use them in your communications.